Hi, I'm Dr. Dan Greenwald. Today we're going to talk about breast enhancement. The first most important consideration are the four equations of balance that we have to solve if we want to get a good result. The first and most important equation is top versus bottom. I want my patients to have good proportionality so that their shoulders, their bust, their waist, and their hips are all in alignment. That way they can go clothes shopping and wear things off the rack without too many alterations. Secondly, it's very important to consider balance between left and right. No one's perfectly symmetric, but I want patients to be close so that there's no distraction of asymmetry. Once we've decided that we're going to enhance a breast, it's important to balance the volume of each breast with the skin envelope that wraps around it. Those are the only two components we have in each breast, and when they're in good balance, patients get good natural results. Finally, when using an implant, it's important that the footprint or the base diameter of the implant match the patient's chest. If the implant is too narrow, it looks like a tennis ball is put in there. And if the implant is too wide, it crowds the cleavage area and hangs off the side, making a woman look heavier than she is. Once we've decided that we're going to use an implant, it's important to determine the route of access. That is, where should the scar be? I prefer placing the scar under the breast in the fold. This allows me to find the pocket in the most safe and reliable fashion, disrupting the least amount of tissue. Other approaches might include the armpit for a woman who doesn't want to have a scar anywhere on her chest. This can be a good approach, but has the additional risk of having the implant move out of position because we're dissecting from above down, and that leaves a potential space. Also, the dissection is a lot longer, which leads to more recovery time and a little more discomfort. Some women prefer to have the implant placed through a scar that runs around the areolar border near the nipple. This can be a good approach for certain women, but it does require that a lot of breast tissue be dissected in order to form the pocket, and I personally don't like that much tissue disruption, particularly for a patient who may later want to breastfeed. Also, even though the scar is generally a good scar, it's exactly at the visual focal point of the breast. People know they're looking at a naked breast when they can see the nipple, and it doesn't make a lot of sense to me to put the scar right where people are looking. Now that we've decided that we're going to use an implant for breast enhancement, it's important to discuss where the pocket should be, and there are two choices, under the muscle or on top of the muscle. Years ago, when we had old generation implants, the silicone would leak out across the membrane and cause hardening. So an implant that was placed under the muscle would be subject to a gentle massage throughout the day, which would keep the implant softer. Modern implants, which I'll talk about in a minute, don't have that problem, and on top of the muscle is probably better in most circumstances. Under the muscle has some significant problems in terms of positioning down the road. An implant that's placed under the muscle is isolated from the rest of the breast by the muscle layer. This can lead to a separation of components where the implant stays up high, held by the muscle, but the breast tissue over time, as women's breasts droop, as they all do, falls off, creating a double bubble contour. This is not a natural result and often needs to be fixed surgically. By contrast, implants that are placed on top of the muscle are in the same location as the woman's natural breast volume. So if a woman is dancing naked on a trampoline or getting older and drooping, the two volumes will move together, leading to a natural result over time. Even when an under-the-muscle implant is perfectly positioned and looks great, every time a woman moves her arms, the pectoralis muscle contracts, and this distorts the implant. Let's talk about implants for a minute. There are basically two types that we have available, saline and silicone. The saline implants are filled with salt water, which is a natural substance, extremely safe, but these implants tend to be a little firm. They tend to have more wrinkling and rippling than other implant types, and we find that after about 10 years, the implants start to break down and leak. This is due to something called crease fold failure, where the edges of the implant rub against each other and wear out. Modern silicone implants do not bear any resemblance to their earlier counterparts that caused all the problems back in the 80s and 90s. Those implants, as I said earlier, were filled with a liquid oil silicone that could bleed across the membrane and cause the implant to fall apart. Modern gel implants, also called gummy bear, cohesive gel, or form stable implants, are filled with a jello-like silicone that can't leak out and can't travel. These implants are warranted for life, and they never need to be replaced. These implants are soft and natural and allow a woman to lay comfortably on her stomach, to get a tight hug from somebody, and most importantly, when someone feels the breast, it feels as natural as it looks. Breast augmentation is not without risk, although the risks are low. The four basic risks of any surgery include bleeding, infection, scarring, and wound healing complications. We don't see a lot of that with breast augmentation. Additionally, risks include asymmetries because there are two breasts, so one may not look exactly like the other, implant moving out of position, implant rippling or wrinkling, or implants getting hard as the scar that forms around them contracts. All of these are easily fixable. The last one's not so much. That would be change in nipple sensation. Taking all breast surgery patients, approximately 4% of women will have a numb nipple when we're done. It sounds like a low statistic, but it happens to you, it's 100%. Generally speaking, breast augmentation is a safe and reliable surgery that can improve a woman's proportionality and her natural look. Thank you. I'm Dr. Dan Greenwald.